Welcome back to the Daily Buzz. Important topic to cover here. Today is National Colon Cancer Screening Day, and one website is leading a nationwide effort to get 1,000 first-time patients screened for colon cancer today. Joining us to talk about the importance of colon cancer screening is Dr. Sanjay Reddy. Good morning, doctor.
Morning.
Important topic here, and it's one of these things where, prevention is the key, right? Early
Absolutely.
detection and so forth. First, tell us who is most susceptible to colon cancer and who should be most focused on this.
You bring up some good points, and the main thing we like to consider is that patients without any symptoms are at risk of colon cancer.
Sure.
So, every American at the age of 50 needs to be encouraged to go out and talk to their doctor.
Okay.
And get screened for colon cancer, just being at average risk.
Okay. Are there certain demographics that are more susceptible?
Absolutely. There are groups of Americans who are at more risk for colon cancer. Patients that have close family members who've been diagnosed with colon cancer are encouraged to be screened earlier.
Okay.
It's important to have a conversation with your doctor.
Sure.
There are certain other groups, such as African Americans, who evidence has indicated are at increased risk as well. So in some cases, being screened at the age of 45 is more appropriate.
Okay.
But in general, the age of 50 is the one to keep in mind.
This is something that the personal question of mine, if you feel as though you have the means and you're just sort of worried about it, say you're 40 years old, is it okay to just go ahead and get screened, or is there any sort of downside to, say, screening before the age that you recommend?
Sure. That's a question that comes up often, and I think that the most important thing is to go in and have a conversation with your doctor.
Okay.
About your individual risk factors and if you have any symptoms.
Right.
Certainly, I see young patients every day who come into my office with a problem, a symptom, and colonoscopy may be the right answer in that case.
Yeah.
In general, we like to balance the risk of a problem with the benefit of a screening test. And what we've found, large trials, a lot of evidence has suggested the age of 50 is really when the risk of any procedure is
Sure.
balanced by the benefit of that test. So it's something to consider.
Now, as a medical professional, when you get a colonoscopy, do you have to yell Moon River like Chevy Chase did? Is that is that an actual thing that happens to all patients?
It's a medical fact.
Yeah.
I think the important thing to consider is, aside from Fletch, we do have a lot of advances in what we've done in the last 10 years to make colonoscopy safer, more comfortable,
Right.
more effective, and that's really why it's made such a dramatic impact on rates of colon cancer detection. Whether you get it done at a high-quality outpatient surgery center that may be more convenient
Sure.
for you to have your procedure done in, for you and your family, or whether we use much better sedatives, deeper anesthesia to make you much more comfortable,
Okay.
Or newer bowel preparations. But we've really made big efforts to make it a much more comfortable test.
And today is the National Screening Day, so please, if you're in those risk categories, go to the website, check it out. We've got the links there at dailybuzznation.com. More when we return, including the benefits of cauliflower.